Good afternoon. This is Sandy Tankus for TOS50.com, the other side of 50. And I'm here today with Dr. Donna Geffner. And Dr. Geffner is the Director of Graduate Programs, Speech Language Pathology and Audiology, and the Speech and Hearing Center at St. John's University. Hello, Donna.
Hi, how are you, Cindy?
Fine, thank you. And we're here today to talk to you about hearing loss. And my first question is, as a person ages, can hearing loss be expected?
You know, Sandy, it's an interesting question because we do know from statistics that over certain ages, we can almost predict that, in fact, over the age of 65, 1 out of 4 adults suffer a hearing loss. And then over the age of 75, we get even more greater proportion of that. And people are over the age of 85, practically more than 50% to 100% of the population can have a hearing problem. So we do see hearing progressively getting poorer and poorer as one ages.
What causes hearing loss as we get older?
You know, when you're around longer, you're exposed to more. So you're exposed to more louder sounds, you're exposed to environmental factors of fumes, you're exposed to disease, you're exposed to vascular accidents and loss of oxygen to the brain and to the fine hearing membranes, certain genetics too. It runs in families. People who have hearing loss as they get older tend to have relatives who've had hearing loss as they aged as well.
Well, how can you tell if your hearing is impaired or if you're just not listening?
It's a good question. I think some of us live with people like that.
Okay.
But I think what happens is people start to ask what, and all of a sudden the symphony doesn't sound as clear, or radio sounds muffled, or maybe your mate might say to you, you didn't speak clearly enough, or you're not talking to me in the same room. You know, that's always the speaker's fault. But it really has to do with the fact that the crispness of speech deteriorates, that speech discrimination gets a little poorer, particularly in noise. That becomes a very distinct characteristic, that when one's in a restaurant or one's in a auditorium or the one goes to a theater, it gets harder and harder to listen. And of course you start to ask what, and can you say it again, and it becomes an issue of embarrassment for a lot of people.
Is there anything that we can do about it?
Sure. Well, first of all, it's a good idea to have your hearing tested, and we do have some very good audiologic equipment and materials that we can test a person's hearing, determine whether there is a presence. And you know, when a person gets older, we don't expect them to have perfect hearing. We do know that hearing does drop, and we have what's called norms for certain age groups. But as among that particular age group, usually we look at the age of 60 and above as having a certain level of hearing that's acceptable. And if you start to drop below that, then yes, then we know that there's a hearing problem, and hearing aids is certainly available. So we need a hearing test. We need to rule out that it's not a pathology of the hearing mechanism, that the person is not experiencing certain symptoms that might be more than just a hearing loss, like dizziness or ringing noises or pain in the ear, so that we have to see an ENT doctor and certainly see an audiologist, which is a person who tests the hearing and determines the need for a hearing aid.
Well, thank you so much for speaking with me today, Donna. I appreciate it. I also will put on the website so people can find you,
Wonderful.
your private practice website.
Thank you so much. Thank you.
Good
Good
afternoon.
talking to you.